Good day, ma'am. I am Jimboy H. Akif. So, the topic that I will discuss in the report is about tuberculosis. So, tuberculosis is a TB or tuberculosis is an infectious disease that primarily affects the lungs by leukemia. It also may be transmitted to other parts of the body, including the meninges, kidneys, bones, and lymph nodes. So, etiologic agents. The primary infectious agents is M. tuberculosis, Mycobacterium tuberculosis. So, when we say infectious agents, it's a microorganism that can cause persons or patients tuberculosis. So, M. tuberculosis is an acid-fast aerobic growth that grows slowly and is sensitive to heat and ultraviolet light. Mycobacterium bovis and Mycobacterium avium have rarely been associated with the development of a TB infection. So how the TB or tuberculosis spread? So mode of transmission is the TB is spread from person to person by airborne transmission. An infected person releases a droplet nuclei. Usually it is particles from 1 to 5 mcm in diameter through talking, coughing, sneezing, laughing, or singing. So the current health status of the tuberculosis in our country, about 1 million Filipino have been active of TB disease. This is the third highest prevalence rate in the world after the South Africa and Lesotho. It is highly accurate, yet it is number one killer infectious diseases. So every day more than 70 people lost their life in the Philippines. So many of their patients is nagdevelop siya drug-resistant tuberculosis, which are more expensive and difficult to treat. So who are the risk factors for the TB or tuberculosis? The person who is close contact with someone who has TB, who has an active TB. So, immunocompromised status. Sino ba ang immunocompromised status? Those are the persons living with HIV infections, cancer, and transplanted organs. They are the risk factor for the TB or tuberculosis. Substance abuses. So, substance abuses, ito yung mga IV or injections drug users and alcoholic. Pre-existing medical condition or special treatments. So, sila yung mga homeless, improvised minorities, children. And number 2 is any person with adequate health care. Sila yung mga homeless, improvised, and minorities and children. Pre-existing. When you say pre-existing of the medical conditions or special treatments, those have a diabetes, chronic kidney injury, or malnutrition. Immigration from the recent or travel to country with a high prevalence of TB, like for example is Southeast Asia and Africa. They have a high rate prevalence of the tuberculosis. So they are also the risk factor. Institutionals are the long-term care facilities, persons who have stay in a long facility term, yung mga the prisons and psychiatric institution. Being a healthcare worker performing high-risk activities. So, as a health worker, they can be transmitted of the tuberculosis because they are taking care of the patients who has an active TB. So now we're going to proceed the pathophysiology of the TB. So TB is begin when a susceptible person inhale mycobacteria and become infected. Susceptible person, they are the prone or low risk of the immune system. Mahina yung mga immune system nila. They are the risk factor. So the bacteria are transmitted through the airways to the alveoli where they are deposited and begin to multiply. So the body immune system is respond by initiating an inflammatory action. Phagocyte like neutrophils and phagocyte and macrophage engulf many of the bacteria, and TB-specific lymphocytes destroy the bacilli and normal tissue. This tissue reaction results in the accumulations of exudate in the alveoli, causing the bronchopneumonia. The initial infection usually occurs 2 to 10 weeks after the exposure. So, the clinical manifestations or the signs and symptoms of tuberculosis, or most patients have a low-grade fever, cough, night sweat, fatigue, and weight loss. The cough may be non-productive or mucopurulent. Sputum may be expirated. Hemostasis may also occur. Hemostasis is the spitting of the blood. So, assessment and diagnostic findings. So, if you want to know that the person who has an TB, we have to an assessment and diagnostic finding. So, to confirm that, once a person present with a positive skin test, blood test, or sputum culture for acid pass bacillar, additional assessment must be done. So ang gagawin for the person to diagnose or to find that for the person who had an TB, so ang mga assessment, mga finding ang test na ginagawa is skin test, blood test, or sputum culture. And additional assessments must be done. Tests include a complete history, physical examination, tuberculin test, chest x-ray, and drug susceptibility testing. So, tuberculin skin test is one of the tests that you will going to determine if the patients have a tuberculosis. So, the Mank-Tooth method is a standardized intracutaneous injection procedure and should be performed only by those trained in its administration and reading. Tubercle test vesicle extract tuberculin purified protein debrided PPB is injected into the intradermal layer of the inner aspect of the forearm, approximately 4 inches below to the elbow. Intermediate strength is a tuberculin syringe with a half 26 or 27 gauge needle is used. So the next test we're going to diagnose the patients is the TB blood test, are the preferred diagnostic test for the patient who have received the BCG vaccine. For the patient who are not likely to return for a second appointment, to look for a reaction to the tuberculin skin test. A positive IgRA signifies that the patient has been infected with TB bacteria and additional tests are needed. So the additional test is the sputum cultures. A sputum specimen may be used to screen for the TB. The presence of IFB on sputum smear may be indicative but not confirm the diagnosis of the TB. Some of the AFB are not and tuberculosis. So, what are the medical management? So, the pulmonary TB is treated primarily with anti-TB agent for 6 to 12 months. A prolonged treatment duration is necessary to ensure the eradication of the organism and to prevent relapse. Several types of drug resistance must be considered when planning effective therapy. So, primary drug resistance. Resistant to one of the first-line anti-TB agents in people who had previous treatment. So, the secondary or acquired drug resistance. So, resistance to one or more anti-TB agents in patients undergoing therapy. Another multi-drug resistance is resistant to two agents, ionizing INH and rifampin. The populations at greatest risk for multiplying resistance are those who are HIV positive, institutionalized, or homeless. Next is the pharmacologic therapy. In current TB therapy, there are 4 first-line medication are used: INH, rifampin or rifadin, pyrazinamide, PZA, and etambutol or miambutol. Combination of medications such as INH and rifampin or INH and pyramide and rifampin and medication given twice a week are available to help to improve patient adherence. Pulmonary TB have 2 phases. The initial phase, it is consists of a multiple medication regimen of INH, rifampin, pyraminate and ethambutol plus vitamin B6 500 mg. Continuation phase. The continuation phase is lasts for additional 4 or 7 months. The 4 months period is used for the large majority of the patient. So what are the nursing managements? So nursing managements include promoting airway clearance, advocating adherence to treatment regimen, promoting activity and nutrition, and preventions of transmission. So as independent nursing actions, so one of these uh, of the most to help to prevent the transmission of the nurse is to help to prevent the transmissions to through health teachings and education. So promoting knowledge and giving them advice what we're going to do, how to prevent the transmissions, to prevent the transmission of tuberculosis.
Assalamualaikum, ma'am. I'm Fojia Bandala. My topic is pneumonia. Pneumonia is an infection that inflames your lungs, air sacs, or alveoli. The causes of pneumonia, virus, bacteria, and fungi can all cause of pneumonia through spread by coughing, sneezing, touching, or even breathing. You say pneumonia happens when germs get into your lungs and cause an infection. The immune system reacts to clear the infections, results in inflammations of the lungs. And pneumonitis is a more general term that describes an inflammatory process in the lung tissue that may predispose or place the patients at risk for microbial invasions. Pneumonitis is an inflammatory of the lungs. And the common causes of pneumonia. A common cause of bacterial pneumonia is Streptococcus pneumoniae, pneumococcus. However, clinicians are not always able to find out which germ caused someone to get sick with pneumonia. Then classifications of pneumonia, 4 types of pneumonia: community-acquired pneumonia, healthcare-associated pneumonia, hospital-acquired pneumonia, and ventilator-associated pneumonia. Then, community-acquired pneumonia, CAP, a common infectious disease, occurs either in the community setting or within the first 48 hours after hospitalizations or institutionalizations. Then, community-acquired pneumonia ay yung makukuha mo sa labas by inhaling dust from the feathers or the waste of infected like animals. The organisms also transmitted by a bite from an infected. Doon mo makukuha yung community-acquired pneumonia. And then, the healthcare-associated pneumonia, an important distinction of HCAP is that the causative pathogens are often MDR. Consequently, identifying this type of pneumonia in areas such as the emergency department is crucial because HCAP is often difficult to treat. Initial antibiotic treatment must not be delayed. So, healthcare-associated pneumonia ay yung makukuha mo sa mga tao sa hospital na meron silang pneumonia kasi ang microorganisms ay nag-spread through common routes or transmissions. Like example, contact, direct or indirect, respiratory, droplets, airborne, sprayed, and common vehicle. Then, hospital-acquired pneumonia. develops 48 hours or more after admissions and does not appear to be incubating the time of admission. BAF can be considered a subtype of HAP as the only differentiating factor is the presence of an endotracheal tube, and then hospital acquired pneumonia can also be spread by healthcare workers who can pass germs from their hands, clothes, or instruments from one person to another. So yung hospital acquired pneumonia ay nakukuha mo sa mga staff sa loob ng hospitals na kung saan yung nakukuha din nila sa mga patient na may pneumonia. So matatransfer sa isa pang patients or sa iyo kapag nasa hospital ka. Yung patient, yung healthcare workers, kapag hindi siya nagsuot ng mga kapag hindi siya nag-hand washing or wearing gloves and using other safety measures. So wearing gloves and using other safety measures is so important inside the hospital. So ventilator associated pneumonia, as noted earlier, BAP can be thought of as a subtype of HAP. However, in chest cases, the patient has been endotracheally intubated, has received mechanical ventilatory support for at least 48 hours. And then, ventilator is a machine that is used to help a patient's breath by giving oxygen through a tube placed in a patient's mouth or nose. An infection may occur if germs enter through the tube and get into the patient's lungs. Ay matatransfer sa iyo ang bacteria, kaya magkukause siya ng pneumonia sa patients. And then, pneumonia in the immunocompromised host includes pneumocystis pneumonia, fungal pneumonias, Mycobacterium tuberculosis, then pneumocystis pneumonia. When you say pneumocystis pneumonia is a serious infection caused by the fungus Pneumocystis cerevisiae. Then, people who get PCP have a medical conditions that weakens their immune systems like HIV, AIDS, or take medicines. Kapag yung patients ay mahina yung immune systems, ay makakuha sila ng pneumocystis pneumonia. And then, just as corticosteroids that lower the body's ability to fight germs in sickness. Then, fungal pneumonias is most common in people with chronic health problems or weakened immune systems and people who are exposed to the large doses. And then Mycobacterium tuberculosis is caused by a type of bacterium called Mycobacterium tuberculosis. It is spread when a person with active TB disease in their lungs cough or sneezes and someone else inhales the expelled droplets which contain TB bacteria. And aspiration pneumonia refers to the pulmonary consequences resulting from entry of endogenous or exogenous substances into the lower airway. Aspirations develop as a result of inhaling food or drinks, saliva, or vomit into the lungs. This occurs when the swallowing reflexes is impaired, just as with brain injury or in intoxicated persons. And then pathophysiology. Pathophysiology. Normally, the upper airway prevents potentially infectious particles, particles from reaching the sterile lower respiratory tract. Pneumonia arises from normal flora presence in patient whose resistance has been altered or from aspiration of pleural presence in the oropharynx. Then, pneumonia affects both ventilations and diffusions. An inflammatory reaction can occur in the alveoli, producing an exudate that interferes with the diffusions of oxygen and carbon dioxide. White blood cells, mostly neutrophils, also migrate into the alveoli and fill the normally air-filled spaces. When you say and bronchopneumonia, when you say bronchopneumonia causes scattered patchy or infiltrates of inflammations in the air sacs throughout the lungs. It is more diffuse than labor pneumonia. Then labor pneumonia causes an inflammations of one lobe of lung and typically involves all the air spaces and single lobe. Risk factors of pneumonia. A very young children and babies whose immune systems are not fully developed, older people with weakened immune systems, pregnant women, people taking medications that suppress the immune systems, people with disease that weakens the immune systems, such as cancer, HIV, and AIDS, and people with autoimmune disease, such as rheumatoid arthritis, people with lungs and respiratory conditions, such as chronic obstructive pulmonary disease, COPD, cystic fibrosis, GF, and asthma. Then clinical manifestations. The signs and symptoms of pneumonia may include cough, which may produce greenish, yellow, or even bloody mucus, fever, sweating and shaking, chills, shortness of breath. This is the sign and symptoms of the pneumonia. Then assessment and diagnostic findings. The diagnosis of pneumonia is made by history, particularly of a recent respiratory tract infections, physical examinations, chest X-ray, or blood culture, bloodstream invasions, bacteremial occurs frequently, and sputum examination. Sputum examination. The sputum sample is obtained by having patients do the following. Rinse the mouth with water to minimize contaminations by normal oral flora. And then 2. Breathe deeply and several times. Then 3. Cough deeply and expectorate the raised sputum in the sterile container. Preventions. Two vaccines offer protections against pneumococcal disease. PPSV 23 pneumococcal polysaccharide vaccines, which helps protect you from 23 types of pneumococcal bacteria, is normally given in adults over age. Yung pneumococcal polysaccharide vaccine ay binibigay sa mga matatanda. And then PCV 13 pneumococcal conjugate vaccine can prevent pneumococcal disease. Pneumococcal disease refers to any illness caused by pneumococcal bacteria. This bacteria can cause many types of illnesses, including pneumonia, which is an infection of the lungs. Then medical management, pharmacologic therapy. The treatment of pneumonia includes administrations of the appropriate antibiotics as determined by the result of culture and sensitivity. However, the causative organism is not identified in half of cases when therapy is initiated. So, antibiotics treat pneumonia by controlling the bacterial or fungal infections. The initial choice of antibiotics depends on the organism presumed to be causing the infection as well as local patterns of antibiotics resistance. And then inpatients should be switched the intravenous, IV to oral therapy when they are hemodynamically stable, are improving clinically, are able to take medication, fluids by mouth, and have a normally functioning gastrointestinal tract. As soon as patients are clinically stable, have no medical problems, and have a safe environment for continued care, they should be discharged from the hospital. Clinical stability is defined as temperature less than or equal to 37.8 degrees Celsius and 100 Fahrenheit. Heart rate less than or equal to 100 beats per minute. Respiratory rate less than or equal to 24 breaths per minute. And systolic blood pressure greater than or equal to 90 Sg and oxygen saturations greater than or equal to, with ability to maintain oral intake and normal baseline mental status. And then other therapeutic regimens, antibiotics are an effective viral upper respiratory tract infections and pneumonia, and their use may be associated with adverse effects. Then antibiotics treat pneumonia by controlling the bacterial or fungal infections. Such organisms, antibiotics depends on the organism presumes to be causing the infection as well as local patterns or antibiotic resistance that given. Then gerontologic considerations. Pneumonia in older adult patients may occur as primary diagnosis or as a complication of a chronic disease. Pulmonary infections in older adults frequently are difficult to treat and result in a higher mortality rate than in younger people. Then complications. And then complication, shock and respiratory failure. When you say shock and respiratory failure, severe complications of pneumonia include hypotension and a septic shock and respiratory failure, especially when gram-negative bacterial disease in older adult patients. These complications are encountered chiefly in patients who have received no specific treatment or inadequate or delayed treat. And pleural effusions is an accumulation of pleural fluid in the pleural space between the parietal and visceral pleurae of the lungs. After the pleural effusions is detected on a chest X-ray, a thoracentesis may perform to remove the fluid, which is sent to the laboratory for analysis. And then nursing process, the patients with pneumonia assessment. Nursing assessments is critical in detecting pneumonia, fever, chills, or night sweats, and a patient who also has respiratory symptoms should alert the nurse to the possibility of bacterial pneumonia. Then, nursing diagnosis. Based on the patient's data, major nursing diagnosis may include the following: ineffective airway clearance related to copious tracheobronchial secretions, fatigue, activity and tolerance related to impaired respiratory functions. Then raise or deficient fluid volume related to fever and a rapid respiratory rate, imbalanced nutrition, less than body requirements, deficient knowledge about the treatment regimen and preventive. And collaborative problems, potential complications, planning, and goals. The major goals may include improve airway patency, increase activity, maintenance of proper fluid volume, maintenance of adequate nutrition, and understanding of the treatment protocol and preventive measures and absence of complications. And nursing interventions, just improving airway patency, promoting rest and conserving energy, promoting fluid intake, maintaining nutrition, and promoting patient's knowledge. Then monitoring and managing potential complications, continuing symptoms after initiations of therapy, shock and respiratory failure, pleural effusions, and delirium. And then promoting home community-based and transitional care, educating patients about self-care, and continuing transitional care for the patients. Then evaluations, expected patients' outcomes may include the following. First is demonstrate improved airway patency as evidenced by adequate oxygens by pulse oximetry or arterial blood gas analysis, then normal temperature, normal breath sounds, and effective coughing. To raise and conserves energy by limiting activities and remaining in bed while symptomatic, and then slowly increasing activities. Then 3. Maintains adequate hydration as evidenced by an adequate fluid intake and urine output and normal skin turgor. 4 is consumes adequate dietary intake as evidenced by maintenance or increase in body weight without excess fluid gain. Then 5. Verbalizes increased knowledge about management strategies. 6. Complies with management strategies. 7. Exhibits no complications. 8. Exhibits acceptable vital sign oximetry and arterial blood gas measurements. And that's all.
Hi, good day. So for today, I'll going to report about MERS or Middle East Respiratory Syndrome coronavirus. So what it is MERS. So Middle East Respiratory Syndrome coronavirus is a new human disease that was first reported from Saudi Arabia in September 2012 after identification of a novel coronavirus or COV from a male Saudi Arabian patient who died from severe pneumonia. Then, etiologic agent. Middle East Respiratory Syndrome coronavirus, or MERS-CoV, was initially isolated from a patient who was admitted to a private hospital in the western part of Kingdom of Saudi Arabia in 2012. Subsequently, MERS-CoV resulted in many sporadic cases, multiple intrafamilial transmission, and major outbreaks in healthcare settings. Then, the mode of transmission. The exact mode of transmission is unknown, but it due to occur from a direct or indirect contact with dromedary camels for example, milking, contact with camel, nasal secretions, urine or feces, or camel product products like unpasteurized camel milk, raw or undercooked camel meat. Then, the risk factors. Direct contact with camels is a risk factor for human infection with MERS-CoV. Then, pathophysiology. The pathogenesis is not completely understood. The virus is transmitted primarily via respiratory droplets from an infected person which enter the human body via the respiratory tract mucosa. Then, clinical manifestations. A wide clinical spectrum of MERS-CoV infection has been reported, ranging from asymptomatic infection to acute upper respiratory illness and rapidly progressive pneumonitis, respiratory failure, septic shock, and multi-organ failure resulting in death. Then, assessment and diagnostic finding. CDC works closely with state and local public health department, travel industry partners, and others to identify the test people who may be infected with MERS-CoV. CDC conducts several different laboratory tests to detect MERS-CoV infection. Then, classification. It is a species of coronavirus which infects human, bats, and camel. The infecting virus is an involved positive sense single translated RNA virus which enter its host by binding to the DPP4 receptor. The species is a member of the genus Beta coronavirus and subgenus Mervecovirus. Then, medical management. Prevention. There is currently no vaccine to protect people against MERS, but scientists are working to develop one. Then the treatment. There is no specific antiviral treatment recommended for MERS-CoV infection. Individuals with MERS often receive medical care to help relieve symptoms. For severe cases, current treatment includes care to support vital organ functions. Then, pharmacology. Rapid development of effective therapeutic option is high priority since no antivirals are approved for the treatment of coronavirus infection nor vaccines are available for prevention. Then, nursing management. Preventing transmission of respiratory pathogens including MERS-CoV in hospitals requires the application of infection control procedures and protocols including environmental and engineering controls, administrative controls, safer work practices, and personal protective equipment or PPE. That's all. Thank you.
So, good day ma'am. My name is Siti Kauzana Milasan and today I will be reporting to you the Ebola. So, Ebola virus disease, the first human outbreak of Ebola virus disease occurred in 1976. So, for decades, the virus maintained a pattern of sporadic outbreaks in remote African villages, followed by intervening periods without any recognized cases worldwide. So in 2014, the virus broke through this usual pattern and rampaged through the West African countries Liberia and Sierra Leone, with secondary cases in other countries in Africa, Europe, and the United States. So we have a different kind of Ebola virus. The first one is Ebola virus, then Sudan virus, Thai forest virus, Bundibugyo virus, Reston virus, and Bombali virus. So we have the mode of transmission, the primary source of infection, and the secondary source of infection. So we will start at the primary source of infection. The virus is transmitted from animals to humans. The virus is zoonotic, means animal-borne, with bats being the most likely reservoir of infection. Then secondary source of infection, this virus can be transmitted from human to human through through direct contact with the blood fluids such as blood, sweat, saliva, semen, or other body discharges of an infected person. Then the second one is the exposure to objects like needles that have been contaminated with infected person. Then we have here the pathophysiology. So Ebola is spread through direct contact with blood or body fluids or urine, vomit, feces, saliva, sweat, semen, and breast milk. So from the person who is ill from the virus and possibly from contact with semen of a man who has recovered from Ebola. So it is not spread through an air, water, or insect bite. In Africa, it may occasionally be spread by handling infected bats or infected wild animals that are sometimes hunted for food. So Ebola virus is only detected in blood after the patient becomes symptomatic and viral levels rise significantly as the diseases progresses. So the incubation period from exposure to first ranges from 2 to 21 days. So if there are no symptoms by 21 days after exposure, there is essentially no risk of developing Ebola. Patients are not contagious to others before symptoms occur. Thorough identification of Ebola contacts and careful symptoms monitoring can prevent subsequent waves of transmission.
A continuation of Ebola virus. So, Ebola virus, the initial clinical manifestation include high fever, muscle ache, and fatigue between the third and fifth systematic day. The patient often develops severe diarrhea, abdominal pain, and vomiting. Patient are the great risk of severe dehydration. At this point, as many produce over 5 liquid stool per day. This stage can persist for a week or more, and many patients develop hemorrhagic shock. See Chapter 14 patient. May also show increasing neurologic symptoms during that period, such as confusion, agitation, delirium, or encephalitis. Delirium or encephalitis, appropriate 5%. 5% will develop bleeding or hemorrhage, a very poor progress test indicator. Patients who do not die during the first or second week of the disease are likely to survive. So, medical management. The medical management treatment is largely supportive maintenance of the circulatory system and respiratory system. It is likely that the patient who is infected will need to ventilator and dialysis support during the acute phase of illness. So, nursing management. The nursing management is mirrors that of medical management and is largely supportive care for the patient with such a devastating disease requires psychological support for the patient and family health care. Workers are at increased risk for acquiring Ebola because they may have contact with body fluids or equipment contaminated from exposure to the body fluids. Because so much virus is present, especially in vomit and diarrhea, the patient should be isolated in a private room away from other patients. So patient must be properly isolated in the healthcare. Workers should be wear complete PPE uniform. So systems must be set up so that unobserved guides each worker to meticulously don't PPE before direct contact with a patient who is infected, to ensure that all equipment is worn correctly after a worker has direct contact with a patient who is infected. And observe should direct care for doffing removal on PPE to ensure that no exposure occurs in the process equipment. Use for the patient with Ebola virus should be used surely for that patient and should be disposed after use. If equipment must be reused, it should be sterilized or scrupulously clean with a bleach-based solution before use. Care for the patient with Ebola requires hospital and transport system to develop plans to coordinate staffing, supply, maintenance, handling, and waste. So we have risk factors. The risk factor, the main risk factor for Ebola virus.
So I'll be reporting for H1N1. So H1N1 swine flu is a subtype of influenza A virus, a communicable viral disease, which causes upper and potentially lower respiratory tract infections in the host it infects, resulting in symptoms such as nasal secretions, chill, fever, decreased appetite, and then possibly lower respiratory tract disease. So this swine flu was the popular name for the virus, which was responsible for a global flu outbreak called a pandemic in 2009 to 2010. And then the scientific name for this is A or H1N1 PDM09 or H1N1 pandemic that started from 2009. It's often shortened to H1N1. So, um, in the spring of 2009, scientists recognized a particular strain of flu virus known as H1N1. So, this virus is a combination of viruses from pigs, birds, and humans that causes disease in humans. So during the year 2009 to 2010, um, flu season, the H1N1 caused the respiratory infection in humans that was commonly referred to as swine flu. So because so many people got around the world got sick, in 2009, the World Health Organization, which is declared the H1N1 flu to be a pandemic. Then for 2000 or August 2010, the WHO declared the pandemic is over. So after the pandemic was over, the H1N1 virus became one of the strains that causes that causes seasonal seasonal flu. And then for etiology or cause, the H1N1 swine flu influenza, these H1N1 swine influenza viruses can potentially cause infections in humans if antigenic characteristics of the virus change. So, in 2009, the pandemic, which started in Mexico with the H1N1 strain, displayed a combination of segments of four different influenza viruses, or the quadruplet genetic reassortment rather. So pig origin flu, North American avian, comprising 94.4%, and then bird origin flu of the human influenza strain, comprising 17.5%, and then for North American swine, comprising 30.6%. Lastly, for Eurasian swine, comprising 17.5%. So due to this co-infection with influenza virus from diverse animal species, the virus were able to interact, then mutate, and form new strains that had variable immunity. Although it had originated in pigs, it was able to spread from human to human. So when the flu spreads from human to human, instead of from animals to humans, there can be further mutations, making it harder to treat because people to have no immunity. And then for mode of transmission, the H1N1 flu virus, since the H1N1 flu virus is contagious, person to person transmission may occur because the virus is easily spread among people. So a person infected with H1N1 flu virus can infect others starting one day before symptoms develop and up to 7 or more days after becoming ill. So influenza spreads from person to person either by inhaling the virus or by touching surfaces contaminated with the virus. And then touching the mouth or nose, then infected droplets are expelled into the air through coughing or sneezing. So for risk factors, People who have a higher risk of becoming seriously ill if infected include children younger than 5 years old, and then adults older than age 65, younger adults, younger adults, and then children under age 19 who are on long-term aspirin therapy. And then people with compromised immune systems due to diseases such as AIDS, and then currently gestating females, then people suffering from chronic diseases such as asthma, heart disease, diabetes mellitus, or neuromuscular disease. So for pathophysiology, the H1N1 flu is an acute disease that infects the upper respiratory tract and can cause inflammation of the upper respiratory passages, the trachea, and possibly the lower respiratory tract. The known incubation period for H1N1 swine flu ranges from 1 to 4 days, and then with the average around 2 days in most individuals. But some individuals, it may be as long as 7 days. And then the contagious period for adults starts about 1 day before symptoms develop and lasts around 5 to 7 days after the person develops symptoms. And then the contagious period may be longer in individuals with weakened immune systems and children, that is 10 to 14 days. The acute symptoms of uncomplicated infections persist for 3 to 7 days, and the disease is mostly self-limited in healthy individuals. But malaise and cough can persist for up to 2 weeks in some patients. And then patients with more severe disease may require hospitalization, of course, and this may increase the time of infection around 9 to 10 days. The body's immune reaction to the virus and the immune response are the causes of the viral syndrome, which includes high fever, coryza, and myalgia. So patients with chronic lung diseases, cardiac disease, and who are currently pregnant are at higher risk of severe complications such as the viral pneumonia, superimposed bacterial pneumonia, hemorrhagic bronchitis, and possibly death. So, okay, these complications can potentially develop within 48 hours from the onset of symptoms. And then the replication of the virus occurs primarily in the upper and lower respiratory tract passages from the time of inoculation and peaks around the 48 hours in most patients. So the recommended time of isolation of the infected patient is around 5 days. So for clinical manifestations, so the various strains of influenza A virus produce identical symptoms. People may experience body aches, chills, cough, fatigue, fever, headache, and then loss of appetite, then sore throat. Also, for some people with H1N1 flu virus have also reported vomiting and diarrhea. The severity of symptoms can vary from mild to severe and sometimes require hospitalization, and then in some cases, severe complications such as pneumonia and respiratory failure can cause death. Like this is seasonal flu. H1N1 flu may worsen existing chronic medical conditions. So that's all.
Assessment and diagnostic finding. So, to test for swine flu, a nose or throat swab is taken. Within 15 minutes, the laboratory may tell if influenza type A or B is present. The specimen of the infected materials from the patient throat or nose is collected within first 4 to 5 days of illnesses. Then, the swine of flu to test is medical diagnosis, which make use of chest x-ray, routine blood tests, and the CBC test to identify any sign of these infections and prevent any pandemic through early and effective treatment or preventions. The most common is rapid flow test. This consists of a nasal or throat swab that provides rapid result in the office in under 20 minutes. So, furthermore, the result of all diagnostic tests for the influenza are dependent upon several factors, including specimen type, quality of specimens collections, and timing of collections, storage, and transport conditions. Then, deficiency along these chains can result in false negative result. When clinical suspensions is high, clinicians should consider repeat a serial testing. Then, for the classifications medical management, place patient in a single patient room with the door kept closed. An airborne infections isolation room with negative pressure air handling can be used if available. If air can be exhausted directly outside or can be recirculate after filtrations by the high efficiency particulate air which HEPA filter. So, suctioning, bronchoscopy, or intubation should be performed in a procedure room with negative pressure air handling. And patients should wear a surgical mask when outside the room. Encourage patients to wash their hands frequently and to follow respiratory hygiene practices. Cups and other utensils used by the ill person should be washed with soap and water before use by other person. Routine cleaning and disinfection strategies used during influenza session can be applied. Then, routine cleaning and infection strategies uh, influenza session apply. Standard droplet and contact precaution should be used for all patient care activities and maintained for 7 days after illness onset or until symptoms had resolved. Then, healthcare personnel should be wash their hand with soap and water or use hand sanitizers immediately after removing gloves and other equipment and after any contact with respiratory secretions. Then, for the pharmacologic therapy, antiviral drugs are sometimes prescribed within the first day or two of symptoms. Then, they could reduce the severity of symptoms and possibly the rest of complications. So, the U.S. Foods and Drugs Administration has approved these four drugs. First is oseltamivir, Tamiflu, and sanamivir with Relenza, Peramivir with Rapebad, and the last is Baloxavir with Soplosa. Then for the last is nursing management. So treatment is largely supportive and consists of bed rest, increased fluid consumptions, cough suppressant, and antipyretic and analgesic with acetaminophen, non-steroidal anti-inflammatory drugs. So, in fever and myalgia, severe cases may require intravenous hydrations and other supportive measures. So, that's all.
Hi ma'am, I'm Fatima Aladi Damsani. So my topic is about COVID-19. So first, what is COVID-19 or coronavirus disease 2019 is defined as illness caused by the novel coronavirus, now called severe acute respiratory syndrome, or coronavirus 2, SARS-CoV-2, or formerly called the 2019 nCoV, which was first identified and an outbreak of the respiratory illness causes in Wuhan City, Hubei province in the China. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without the special treatment. However, some will become seriously ill and require medical attention. So for mild COVID-19 or mild case lang, so typically symptoms such as cough, fatigue, or loss of taste or smell. So dito sa mild case is yung patient is hindi naka-experience ng shortness of breath or abnormal chest imaging. So for severe COVID-19, seriously ill should call the emergency medical service. Kailangan niya daling sa hospital or kailangan niya nang i-isolate. So, symptoms, trouble breathing, nahihirapan na siya huminga, bluish lips or a blue face, persistent pain or pressure in the chest, and confusion and excessive drowsiness. And the cause of COVID-19 or the coronavirus are zoonotic. It means they first develop in animals before being transmitted to human. So, I will explain how this coronavirus is transmitted. So, transmitted when people breathe in air contaminated by the droplets and small airborne particles containing the virus. So, pag yung infected patient na may coronavirus may COVID So, kapag huminga yung infected person, tapos nandun lang kayo sa isang room, pwede mo makuha pwede ka matransmitan ng coronavirus through airborne sa hininga ng isang infected person. So, also, pwede din sa object na nahawakan ng isang infected na person. So, this virus causes more death than the seasonal flu. So next is assessment. Identify the signs and symptoms the resident with COVID-19 is experiencing. Common symptoms include but are not limited to fever symptoms of dehydration such as increased confusion and headache, and compromised respiratory status including cough, shortness of breath, and impaired oxygen exchange. So, kailangan sa assessment is kailangan mo i-assess yung sign and symptoms na nakikita mo sa isang patient na related sa COVID. And the shortness of breath, loss of taste or smells, and the fatigue na na-experience ng isang infected person. So next is assessment is the first step to care of the COVID-19 patient, so which involves the critical thinking skills, clinical judgments, risk identification, history, physical examination, yes, and the appropriate decision-making strategies by the nurses. So, kailangan i-assess mo yung history ng patient and physical examination, then travel history. So, for travel history, kailangan mong i-assess yung travel history to determine which patient were at risk of COVID-19. So, kung saan niya nakuha yung sakit na yon. At for the physical examination, careful documentation of the patient's signs and symptoms, which may develop 2 to 14 days. Signs and symptoms include the fever, chills, cough, headache, fatigue, and a sore throat, loss of smell or taste, and runny nose or vomiting and diarrhea. So, kailangan mo i-assess yun. And the respiratory and cardiovascular status of the patient. So, not every patient with COVID-19 experience all these symptoms. Other are asymptomatic. That's why the protocol should perform swab tests, antigen, and the saliva test. So next is nursing diagnosis. So identify how signs and symptoms of the COVID-19 infection are impacting the residents, and address the risk of more severe respiratory complication even if the patient's severe respiratory complication and currently only experiencing mild symptoms. So next is respiratory failure and acute respiratory distress syndrome related to disease condition as evidenced by the hypoxemia and respiratory distress and decreased PaO2 and FiO2 ratio. So you need to identify uh, the sign and symptoms na paano nag-impact sa residence or community ng patient. And i-identify mo din kung mild or severe lang ba yung symptoms na nakikita mo sa patient. So next is fear of an unrelated to isolated environment, less interaction, and unrecognizable health workers as evidenced by the patient's facial expression. So you need to determine na yung fear na nakikita mo sa isang patient kung kung okay ba yung nararamdaman niya or hindi okay yung nararamdaman ng isang patient. So, difficulty in breathing related to disease condition as evidenced by the increased respiratory rate, cough, decreased oxygen saturation, and use of accessory muscles. So, i-assess mo yung, i-identify mo, yung nursing diagnose mo yung kung yung patient is nahihirapan huminga. So, i-relate mo doon sa disease or illness na nakikita mo. Then is i-check mo yung respiratory rate ng isang patient kung mataas or mababa. And i-check mo din kung may symptoms ba yung patient mo like cough and masakit ba yung mga muscle ng patient. So next is for the classification. Classification, simple clinical classification, grade type clinical findings. For 0 is asymptomatic yung patients, individuals without clinical signs. So for 1 is mild outpatient and patient with mild clinical symptoms or lower or upper respiratory tract infection. Sa mild is or mild cases is yung symptoms, fever, cough, fatigue, no signs of pneumonia. Or for management is home isolation lang yung para sa mild cases. Or home isolation is for 14 days or sent to community quarantine facility. So next is for 2 is moderate patients requiring hospitalization with labor or multi-labor pneumonia with or without no need to supplemental oxygen or refractory to initial treatment. For moderate is with sign of non-severe pneumonia. Example is fever, cough, difficulty of breathing. Yung RR na is 21 to 30 beat per minute. So, the management is admit to the COVID-19 designated room or unit. So, kailangan mo nang dalhin yung patient, yung client mo sa hospital, admit sa isolation facility. So, next is 3, severe patients who need ICU treatment na or invasive mechanical ventilatory support or with acute respiratory distress syndrome and or non-pulmonary involvement. For severe is severe pneumonia. So, severe means yung malala. Is diagnostic is ABG, CBC, at marami pa. So, next is very severe or critical patients who multi-organ failure and or cytokine storm. Dito is new respiratory. Dito is may COVID yung isang patient at sobrang severe, very severe sa isang patient, life-threatening to. And pwede ma-affectan yung isang organ yung isang part or organ sa katawan ng isang patient. So, for classification of patients, yan, asymptomatic mild symptoms and hospital isolation management. So next is medical management. For medical management, monoclonal antibodies are synthetically derived protein that help the body develop an immune response against the foreign-made substance such as viruses. These medications are yan mga medications. So, that medication will help the body improve your immune system. So, these medications, so next is you need to perform strict hand hygiene. So, kailangan mo malaman yung proper hand washing or hand hygiene and maintain social distancing. Kailangan mo makipag-distansya sa ibang tao. Hindi ka po you're not allowed to go in the crowded places. Use face mask, face shield, and eat healthy foods, vegetables, mga healthy foods na lumakas yung immune system natin. And for nurses is use PPE when you care COVID patients with NCOV. So next is danger signs of NCOV. Difficulty of breathing or shortness of breath, bluish lips or face, gasping for air when speaking, cough up with blood, pain, pressure in chest, altered mental status or severe sleepiness, inability to eat or drink or walk. Any other significant change in the condition. So next is pharmacologic therapy. Pharmacological therapy or pharmacology is the treatment of a disorder or disease with medication. In the treatment of addiction, medication are used to reduce the intensity or of withdrawal symptoms, reduce control and other drug cravings, and reduce the likelihood of use or relapse for significant drug by blocking their effects. So, antibody therapies is Covishield, AbbVie, so yan yung mga antibody therapy. So, pharmacological treatment of COVID-19 inhibitors of the viral infection. So, ribavirin, remdesivir, favipiravir, and tenofovir, and oseltamivir. So, nursing management. Nursing management for patient with COVID-19 infections is the development of the nursing care plans and goals, intervention, evaluation, and documentation. So, sa nursing management is dapat yung isang nurse is my goal to para makamit niya yung para is easily to manage sa infected patient, to relieve the fear of the patient, to bring down the body temperature to normal range para dapat is yung body temp ng isang infected patient is bumaba. And for nursing intervention, based on the assessment data, nursing intervention for COVID-19 should focus on the monitoring of vital signs. So, dito sa nursing intervention is if na-focus yung pag-monitor ng vital signs ng isang patient. I-check yung body temp, RR, PR ng isang patient. Then, maintaining respiratory function, dapat is yung respiratory organ ng isang patient is maintain normally. Nagfa-function normally. And managing hyperthermia and reducing transmission. So next is assess for sign of difficulty in breathing such as changes in respiratory rate and breathing pattern. I-assess yung signs ng difficulty of breathing, and kapag ba yung patient mo is pag mag-breath out yung patient is na-change ba yung respiratory rate ng isang patient or yung breathing pattern na is not normal. And monitor the axillary body temperature of the patient. Dapat is i-monitor mo yung body temp ng patient. The normal range of body temps is 36.5. So, kapag tumaas yung body temp ng isang patient is may fever yon. So, next is remove extra clothing. Dapat yung patient is dapat comfortable yung isang patient. And keep the patient's environmental cool. Dapat yung facility or isolation ng isang patient is di madumi, dapat malinis, and dapat comfortable sa facility, sa isolation room ng isang patient. Next is keep the patients hydrated. Dapat yung patients is marami siyang inom na water, or 8 glass a day, 10 glass a day, and para hindi siya dehydrated. Pag kasi yung dehydrated yung isang patient is, pag mild symptoms, pwede maging severe symptoms na yung naramdaman ng isang patient. Then, assist fluid balance and skin temperature of the patient and monitor the vital signs. So, contact and droplet precaution for the nurses is place patient properly ventilated single room. Dapat is yung isolation di magkasama, hindi sila mag-isa lang yung patient sa room niya. Every patient may iba-ibang rooms. Then don PPE with any patients can contact and remove when leaving the room. So dapat pag alisin na yung PPE, dapat walang tao na katabi or kasama mo sa isang area na yon pag alisin na yung PPE. And dapat hindi ka mag-remove sa isolation room, dapat sa ibang area. So use single disposal equipment. If equipment must be shared, clean with 70% alcohol between each patient use. Dapat isang alcohol sa isang patient. Hindi pwede share yung isang patient sa isang patient. So, dapat may 70%. And clean and disinfect patients' contact surfaces regularly. Dapat malinis yung room ng isang patient. I-disinfect all the object surfaces in the patient's room. And airborne precaution. Instick for any aerosol generating procedures. Use particular respiratory N95 mask. And don PPE, perform procedures in negative pressure room. And limit the number of the people in the room and monitor required to care and support the patient. Dapat is sa isang facility is hindi madami yung people nandoon. Dapat limited with social distancing. So, last is evaluation. Evaluation help the nurse to determine if they have met their goals, and evidence for meeting nursing goals for COVID-19 might include the patient successfully prevented the spread of infection to family, to the community, or to the healthcare staff. Dapat mas successfully mo na-prevent na spread yung infection ng isang patient sa kanyang family, sa community, or sa healthcare staff nandoon sa facility na yun. And then, the patient learn more about the COVID and its management. Dapat turuan mo yung patient mo about COVID at paano i-manage yung COVID-19 at paano din yung treatment ng COVID-19. So, next is the patient had improved body temperature levels. So, dapat yung patient, ma-met mo yung goals na bumaba ang temperature ng patient. 36.5, 36 point something, na hindi tumaas ulit na 37.8, 38.9, yan. So, next is restoration to normal breathing patterns. Yung breath pattern ng isang patient is within normal. Normal na hindi na nahihirapan huminga yung patient. Next is reduce anxiety. Reduce anxiety, hindi na siya natatakot about that illness, about that problems. So that's all. Thank you. Start saan?
Good morning, ma'am. Today, I'm going to report my topic about COVID-19. So first is, COVID-19 is a coronavirus disease in 2019. The highly contagious infectious disease caused by severe acute respiratory syndrome and coronavirus 2, SARS or SARS-CoV-2, has a contatropic effect on the world's demographic, resulting in more than 2.9 million deaths worldwide, emerging as the most consequential global health crisis. Most people, most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill, require medical attention. So the mode of transmission is the virus that caused COVID-19 is spread primarily through the droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching and a contaminated surface and then touching your eyes, nose, mouth before washing your hands. So the risk factor is developing dangerous symptoms of COVID-19 may be increased in the people who are older and also in the people of any age who have other serious health problems such as heart or lung conditions, weakened immune systems, obesity, or diabetes. This is similar to what is seen with other respiratory illnesses, such as influenza, while each of these factors can increase the risk of severe COVID-19 symptoms. People who have several of these other health problems are at even high risk. So the pathophysiology is the transmission of infection. The transmission of infection is mainly person to person through respiratory droplets. Fecal oral route is possible. Possible the presence of the virus has been confirmed in sputum, pharyngeal swab, and feces. Vertical transmission of SARS-CoV-2 has been reported 6 and confirmed by positive nasopharyngeal swab for COVID-19. The median incubation period of COVID-19 is 5.2 days. Most patients will develop symptoms in 11.5 to 15.5 days. Therefore, it has been recommended to quarantine those exposed to infections of 14 days. So the clinical manifestation is in COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. So most common symptoms is fever, cough, tiredness, loss of taste or smell. Less common symptoms is disease, go to every dialysis appointment. Let your doctor know if you fell ill. So the mental health conditions, people with mental health conditions such as depression and the spectrum disorders can be more likely to develop serious COVID-19 symptoms. So Down syndrome is an people with Down syndromes are more likely to develop lung infections in general. So they are particularly vulnerable to COVID-19. They are also a higher risk of already having many of the health problems that have been linked to developing severe COVID-19 symptoms, including the heart disease, sleep apnea, obesity, and diabetes. So many adults with Down syndrome live in the nursing homes where it can be harder to avoid exposure to germs from other residents and staff. Down syndrome also often affects intellectual abilities, so it may be more difficult for this population to follow prevention measures. So sore throat, headache, ache and ache and pains, diarrhea, a rash on skin or discoloration of fingers or toes, red or irritated eyes. Serious syndrome is difficulty of breathing or shortness of breath, loss of speech or mobility, or confusion, chest pain. Seek immediate medical attention if you have serious symptoms. So, in the people with mild symptoms who are otherwise healthy should manage their symptom at home. So on the average, it takes to 5 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Thank you. That's all.